Welcome to Family Vlogs, and today we are continuing with episode 3 of Focused Antenatal Care, of which we are still discussing this particular booklet. And in our discussion of today, we are going to discuss about preventive services that we normally give a pregnant mother when she comes for antenatal care. And these ones are in relation to tablets or injections or anything that we give these mothers when they come for antenatal care, including continuous counseling. If you love this channel, please click the red button written subscribe, turn on the notification bell for more videos that we will post. And if you love the videos that we'll post, this M-Pesa number, you can donate even via SendWave if you are in US, UK or USSR. Also, there's PayPal button down here. In terms of your donation, we will really appreciate. Now let's get to work and let's do it about preventive services that we normally do. And if you did not watch my season 1 and season 2, kindly click the link that appears up here for season 1 about further support, and we will really appreciate if you continue supporting us in terms of viewing this our channel. And for our new subscribers, you are welcome to this channel. For my loyal subscribers, thank you so much and continue supporting us. Also, you can watch about Focused Antenatal Care Season 2 by clicking this link. It is about antenatal profile impotence or impotence of antenatal profile. Click that link and do enjoy. Now, let's move to the topic of today. In our discussion, we'll start by talking about a disease called tetanus and its prevention. And we also talked about malaria and prevention. We also mentioned a few things to do with worms. I've talked about worms and different types of worms and different types of signs and symptoms in regards to this worm. If you have not watched the video that I started introducing by asking a simple question that when did you deworm last? If you have not watched that video, kindly click the link that appear up here so that you can know different types of worms and even deworm yourself. We normally only deworm children, but not knowing that worms do pose a lot of threats to even adults other than children. And in this relation, on this topic, we are going to discuss worms and prevention in pregnancy. And last but not least, we are going to talk about anemia. So those 4 important parts of discussion of today. Stay tuned and let's continue. Now, tetanus normally pose threats to pregnant mothers, and for us to know the causative organism of this particular disease is called Clostridium tetani, which is a bacteria performing, and it is found everywhere, anywhere. We can find them in the soil, in our clothes, in our normal environment, even in our skin. You can find tetanus, or even the rusty nails, the barbed wires, you can find tetanus. That's why when we are delivering a woman, we must do it under sterile environment. Of course, we normally put our sterile gloves, sterile gown when we are doing delivery. And the reason why we are more serious with this tetanus, because it poses threats, and when it has knocked you, you will exhibit signs and symptoms of even muscle spasm, lockjaw. You will not be able even to open your mouth, will not be able to swallow. You will develop fever, you will develop convulsions, and this one can affect the mother, even the child, intrauterine or post-delivery, and this child might not even able to celebrate the first month of his or her life. And that's why we are very, very serious with prevention of this tetanus. Now, what will we do in terms of prevention of this tetanus when a woman or a mother comes for antenatal care? There is a schedule that I want us to do, and when you are a mother and you have this book, kindly refer to page 9 of 44 in the latest edition of this particular booklet. And we will giving you tetanus 5 times, but there is a schedule. There is tetanus 1, tetanus toxoid 1, tetanus toxoid 2, tetanus toxoid 3, tetanus toxoid 4, and tetanus toxoid 5. And listen to this carefully, and this is an instruction that I want you to put in place so that we can avoid what we are doing on a wrong way. Now, 1. All antenatal clients should be asked about the number of tetanus toxoid injection that they have received in their life, including those after injuries and through schools. This form part of 5 tetanus toxoid injection that I've mentioned, and if none given, start as follows. For the sake of this video, we will verify this as per a mother who is coming for antenatal care for the first time. Also, we'll talk about how we give tetanus toxoid injection for subsequent pregnancies. Now, listen to this. Tetanus toxoid 1, given to prima gravida or on first contact. Prima gravida are those mothers who are pregnant for the very first time. So when they come, we give them tetanus toxoid 1. Now, tetanus toxoid 2, given not less than 4 weeks after tetanus toxoid 1. And in this scenario, we will give you a 1 month appointment after giving you tetanus toxoid 1. So it means that you will be getting tetanus toxoid at the beginning, and after 1 month, that is 4 weeks, we'll give you another shot of tetanus toxoid. Of course, we give at the left upper deltoid muscles, the left one. Yes. Now, tetanus toxoid 3, given during second pregnancy. Second pregnancy. Kindly note this. Tetanus in the first pregnancy, we only give 2 times. At the first contact and after 1 month. Note that what we normally see in practice, that each and every month a mother comes for antenatal care, she's given a shot. Listen to this carefully. I repeat again. Tetanus 3, given during second pregnancy, anytime before 8 months of pregnancy. Tetanus 4, given during third pregnancy, anytime before 8 months of pregnancy. And lastly, tetanus 5, given during fourth pregnancy. This gives protection for life. And there's a special note that when you are using 5 tetanus toxoid schedule during focused antenatal care that we are talking about, the interval between pregnancy sometimes is not relevant, particularly when it is greater than 10 years between the first and second pregnancy, because the body immunological memory responds well to boosters, does not even beyond the recommended time for boosters. And we continue saying that in terms of tetanus toxoid, only when the interval between the first and second pregnancy is greater than or equal to 10 years, schedule be restarted from TT1. And this rule does not apply to interval greater than 10 years between second and third pregnancy or third and fourth pregnancy, meaning that long delay between TT2 and TT3 is more risky than a long delay between TT3 and between TT4 and TT5. Now, that is all about how we give these shots, and let us take into consideration this. So our pregnant mothers, kindly come to the hospital so that you can be prevented against tetanus. Number 2, the second service we are going to give is called intermittent preventive treatment. That is prevention of malaria. That in a woman lifetime, we should be always giving malaria prophylaxis from 16 weeks. That is why almost all these preventive services we normally start giving at 16 weeks. Sometimes somebody might ask, when should I start antenatal care? When I'm gravid or when I'm pregnant. A mother can come and visit or start antenatal care as early as she has realized that she's pregnant. But the medications that we are going to initiate into you in terms of preventive services, we are going to start giving you at around 16 weeks of pregnancy. Now, in malaria prophylaxis, there is a schedule that we are going to give you this pill. IPT given SP, that is sulfadoxine and pyrimethamine, 4 weeks interval from 16 weeks gestation to term in malaria endemic areas. We will insist that we give you that drug and swallow it in our presence. We used to give them early, that when they reach home they take, but they normally discard because maybe of signs and symptoms, or maybe because of side effects of this particular pill or this particular drug. So there is a interval of giving this malarial prophylaxis, and the interval is 4 weeks apart and up to IPT 7. So there's 1 up to 7. And the reason why we want to prevent malaria is that malarial parasite normally attacks the placenta, and signs and symptoms of malaria might exacerbate until it results to severe malaria, which might affect the mother and also the child. Of course, we are afraid, or we do not want you to succumb or to die because of severe malaria, or because of simply having malaria. We do not want intrauteral fetal death. We don't want your child to die in the uterus. We don't want intrauteral fetal growth retardation. We want your fetus or your baby to be growing well without any stress. Even the time you are going to give birth to this child, we do not want low birth weight. So that is why we insist on giving you this particular drug, so that even if you deliver a child whose weight is up to the normal weight that we should be given. Even we do not want you to deliver premature baby, and those are complications that we are trying to avoid by giving you this particular anti-malarial drug. This is different from the one you normally get when you are malaria positive. This is for prevention. This is not the normal one you call Coartem or AL, artemether lumefantrine, that you normally take 4 at the time you are diagnosed malaria, then 4 tablets 8 hourly, after 8 hours and then 12 hourly for the next 2 days. This is a different one, and all pregnant mothers who have passed through clinics, they normally know about this particular pill. 2, we will issue you with net. We call it long-lasting insecticide treated net, LLITN. So we will give you this particular net so that you sleep under this particular long-lasting treated net, giving a long life of 5 years. Some normally give for 10 years. This particular net we don't give you so that you go and fence your kitchen garden and leave yourself and maybe your unborn child and your born child, if you have delivered, to be attacked by female Anopheles mosquito, thereby transmitting you malaria. We want you to be sleeping under this particular net and making use of it. Of course, if you come, we will even rubber stamp this particular booklet, and we say that we have issued you with a net. Now, apart from malaria, we'll do deworming that we have talked about, and I've even told you where to get the link of types of worms that I talked about in the previous video. There are some worms that pose threats to pregnant women, and these worms can deprive a pregnant woman from correct nutrients, or even predispose them to anemia, and even can cause intestinal obstruction if they are too much, particularly the Ascaris lumbricus, the round worm. And another worm, the threadworm that we normally call Enterobius vermicularis, the one that normally makes the anus to be so much itchy, and you scratch your anus very frequently. That Enterobius vermicularis is also posing dangers, as I've mentioned, to pregnant women. Even the trichuriasis, trichuria is also another worm, the whipworm, that is posing threat. So we will give you a single dose of mebendazole, which we also insist that you swallow in our presence, because of what I've mentioned earlier. Some do not normally swallow these pills if we give them to go home with. So we'll give you that single dose of mebendazole, 500 milligrams start, and then this particular worms will be taken care of. And again, in prevention of anemia, we will also dispense you tablets that are helping to boost blood levels so that you don't develop anemia. You know, your fetus needs something. Also, you as a mother who is pregnant, you also need nutrients, and in this nutrient is where the blood normally develops. And we will issue you with IFAS, and this IFAS is ferrous fumarate containing two components, that is iron and folic acid. Iron is very, very important in making you to boost blood. Initially, we were giving folic acid this side and iron this side, but we realized that iron has metallic taste that normally pose side effects of nausea and vomiting, and most of the pregnant mothers, if they are given this pill, they were not taking. So it was decided that now we give you a combination of 2-in-1, which has less side effects, and that we call them IFAS, that is iron and folic acid. The reason why we give you this particular iron and folic acid is, one, to prevent you from developing anemia. Also, folic acid is very, very important in that it helps to prevent problems that can interfere with the DNA, thereby preventing even cancer, and also helping in development of new cells. Also, folic acid is very, very important in prevention of what we call neural tube defects, and one of the examples of neural tube defect is spina bifida. You will find that a child born and has signs and symptoms depicting of spina bifida has some protrusions on the spine, and if you get a child born and has some protrusion on the spinal column, then you will realize that this mother was not making use of IFAS. And these children, they normally don't celebrate their first year of life. They develop neurological problems, they will convulse, they will not breastfeed, they will have growth retardation, and eventually organ failure, and they die. So this particular drug is very, very important, and mothers, please kindly take this drug. And of course, we have schedule of how we give you this drug. This drug, we will not monitor you that you swallow there and there, because there are many, and if we give you 1 month appointment or 2 months appointment, you are able to take them home and swallow them daily. Of course, we'll do adherence counseling about this drug. In our adherence counseling, we'll instill that you take this drug daily, and we inform you of the side effects, majorly feeling to vomit, that is nausea and vomiting. And also we expect you that if you feel nausea, you can even take crepes, this chewable food that normally prevent you from developing nausea. Of course, if nausea is too much, there's a drug we can give, Placid, so that, or Nosic, so that the nausea and vomiting subsides. Now, this is the schedule. We have 4 schedule, and I insist that at least a mother should be coming for antenatal care 4 times at least. So first, what will we do? In the first visit, that is around 16 weeks, as I went on earlier, we'll give you 90 tablets, and we tell you the date and the time you will come back again. At second visit, that is 28 weeks, we'll give you another 90 tablets. And third visits, we'll give you 60 tablets, and fourth visits, we'll give you 30 tablets. And of course, we will insist that you take these particular tablets without failing, because we want you to not develop anemia, because when you are delivering, when you are in the delivery table and labor has started, the cervix dilating, and the progress of labor is going on and you deliver, there must be some bleeding, either minimal bleeding or excessive bleeding, what we call postpartum hemorrhage. So minimal bleeding, if you are bleeding, develop bleeding, and your hemoglobin was very, very low, meaning you are not taking this particular drug, it might complicate to severe anemia, and that is what we do not want, because even nowadays getting blood for transfusion is very, very difficult. If you love this video, click the notification bell, written subscribe, turn it on for more videos that we post. And if you love us so much, and if you love what we are doing in this channel, this M-Pesa number, even if you are in UK or US, you can use SendWave to send to us and support this channel. Of course, I'm very, very happy for the SendWave that I received from United States, around $20, and this one supported this our channel for buying for us bundles for internet. Otherwise, thank you so much, and may God bless you. See you in episode 4 of Focused Antenatal Care. Muchas gracias.